Hello, I'm here again with the Empowering You Nurses show. I know you have been excited with some of the topics we have been talking about, we have been discussing, but today we'll be talking about some of the experiences that I've had and have shared with others, and others have shared with me. I'm Dr. Miriam Smith. I'm the host for the new Empowering You Nurses show. And today, we'll be talking about, I'll be telling you of a few tips that can help nurses, young nurses, and even older nurses too. I've spoken to nurses from different parts of the world, and there's so many commonalities, of which I will identify a few of them today. Now, I've taught in academia, I've been a med-surg nurse, I've been an orthopedic nurse, I've been a critical care nurse, and many other areas. I've served in the community nursing, and as an educator, I also specialized in critical care. Matter of fact, critical care allowed me to come to this country. I was recruited here in 1986 as a critical care nurse. There, I was trained at the University of the West Indies in critical care after I pursued my BSN at West Indies College, now Northern Caribbean. And I have grown in different areas of nursing. But as I said, today my specific role will be talking about some tips that have helped me along the way. And I know that I'm a baby boomer nurse, and I know that there are many other nurses who, from my time, actually had some of these experiences, and these experiences have helped us along the way to ensure that patients receive high quality, best care. So, as a new nurse, there are many encounters and there are different experiences as a new nurse. Some of them I'll just address. I will continue in another episode, but I will mention some today. For example, as a new nurse, you can become very anxious, very fearful, fear of the unknown, not knowing what assignment you're going to be getting, fearful of talking to the doctor, just scared of making any mistake, any error. And let me let you know right now, that's okay. That is normal at this stage, especially in the first 3 months, 6 months, and even 1 year. As you gain your experience, this anxiety, this fear lessens. So at this time, I want to reassure you that don't think that you are not in the right profession because of these episodes of experiences that you might have. Remember, nursing can be challenging. It can be hard at times. But once you want to do your best for patients, once you want to give or administer or render the care for humanity and you're passionate about it, this too will pass. You will gain experience and the fear will be lessened and the anxiety will also be lessened. So let me hasten to tell you give you some tips that has helped. Those tips have helped me, and I know they have also helped others. So, as a new nurse, think of it this way. You're going to be going to work. There's a fear sometimes from the day before, or even because you're not sure of the assignment you don't know who you're going to be meeting. So, that fear, it's important to get some rest before you go to work. The night before it's day, you get some rest before you go to work so that your mindset will be different. Go with the right attitude. Be willing to learn, willing to adjust, willing to meet people. Have the right attitude. Say hello. Try to bond and talk with others as you go. Another thing, be intentional in getting to work before the shift starts, even 15 minutes before, so that you can scan the area You can look at the chart. You can see the type of patients on the units and stuff like that. It's very important because then that will help to start lessening some of the anxiety when you start getting your patient load. Also, take what you need as a nurse that you're going to be using. Think of it this way. Common sense, you're going to be having your pen, you know, your stethoscope, your watch, and so forth. But always remember, as a new nurse, have a little notebook, because you're going to be meeting on cases, you're going to be hearing some terminologies, and remember, you might be a very good nurse in school in terms of getting the grades and so forth, but when it comes to the clinical part, it's not so, because it's new. You're learning. So it's important. Have your little notebook so you can jot down points, jot down little experiences beside, and then you can go and you can research. You have resources right there. You have your preceptor, you have other nurses, you have the manager, you know, and remember, you also have the PC and the CNAs, and so the respiratory therapist, the physical therapist, the infection preventionist, and we could go on and on. Doctor, you know, different disciplines, or the interprofessional team, the person, the environmental person. They all as a team, we all as a team work together for the good of the patient. Patient-centered care. So we all pool our different resources so that the patient will receive adequate care. As a young nurse, as a junior nurse, it's important. I know you're anxious, you want to do your work, but remember, although you may be so enthusiastic, you have to cluster your care. Cluster what you're going to be seeing your patient. What is it that the patient needs? Whatever the patient needs, put them all together. For example, you bring in the medication, you're going to bring the water, you're going to find out before you leave the room if the patient wants to use the bathroom or stuff like that. The bed is at the lowest level so that the patient doesn't fall out of it and hurt. So all of those things. So in your head, there are many things going on. So you have to be organized, all right? And never scared to ask any question. It's so important to ask questions. You're not sure of anything, you're not sure of a procedure, you're not sure of something. Make yourself visible. There might be a procedure that's being done on the unit and it's not your patient. However, as a prudent nurse, you're becoming prudent. You're gonna make sure you're gonna ask the nurse with that particular patient, and you want to learn from that procedure if you could assist. You know, make yourself visible and show interest and help others. Don't be the type of nurse who don't do this and don't do that. No, listen, nursing is nursing. So there's nothing in nursing that you shouldn't be able to do. However, you'll be able to delegate. There are times, of course, you have to delegate. You as a registered nurse, you will delegate. But let me hasten to say, as you delegate, there are things that need to be done at a certain time, and the person to whom you have given the delegation or you've delegated to is not there, and you have the time. It's your responsibility to do that. To do that. Handing a bedpan is not just the PCA. You can hand the bedpan too. And the patient, of course, will realize that you are a rounded nurse. You are a nurse who cares not for both the physical and the mental pain of the patient. Okay? Now, before you go to work, it's important to make sure that you prepare for work, mentally, physically, and otherwise. And you know, nurses will tell you sometimes they don't even get the chance to go to the bathroom, how it can be so challenging, although they planned. Okay, so always bring with you a little snack or something that you can I would say Monchan. So it's important to think of yourself and think of others. I said, show interest in your work. Not every time a nurse, you will be occupied and you'll see your colleague there busy and you're not so busy. It's for you to fall in and help. And if you do that, when your time comes, when you are busy, someone will also help you. Of course, you will be thinking of the nurse who is approachable. Not everybody, and that's human, not everybody likes to, I would say, precept, but you do have individuals there who are always willing to help, and you can learn from them. Just remember, you must have the right attitude. Time management as a new nurse can be challenging because you want to do this, you want to do that, and the work it seems. So ask for help. It's important to ask for help. Nothing is wrong with that. But you have to initiate, you have to do something. And if you think that the assignment is not fair, you also have a responsibility. You have to advocate for yourself. That's very important. They'll be stepped on. In addition to all of that, because you're new and you don't have a lot of experience as yet, you might be timid to ask questions. But let me let you know that you have a right to ask questions because that will prevent errors. So you're going to ask, when the report is being given, you're going to ask questions, things that you need to know. It's okay. It's okay. I will continue with a few more tips in the next episode. So let me hope that these tips that I've given you will be helpful to you. I am Dr. Miriam Smith, DNP. It's a pleasure to share some of my experiences and tips with you. Let me hope you'll find them helpful. I look forward to your comments. I look forward to hearing from you. I look forward for you to follow me on Facebook, Miriam Smith, on Instagram, Podcast Mir, on Apple, Miriam Smith, on YouTube, Miriam Amanda Smith. Look forward to hearing from you. Follow the links and take care of yourselves. Don't overwhelm yourself. I assure you again that things will get better and lighter. And in so doing, you will be able to help someone else who's coming on, who is new. Thank you so much. Have a great day. And if you have to comment, make sure you do so. I look forward to hearing from you. Have a great day. A productive one.